Good evening, Los Angeles. Whether we stop the threat of COVID-19, whether we save lives and preserve livelihoods, is up to us. COVID-19 has taken control, and it's time for us to take control back. For each one of us to embrace our role as a life-saver, a life-giver, someone who can preserve our economy, preserve our health, and deal with the challenges that are in front of us. I think it was said best by one of our city's leading infection disease experts, Dr. Robert Kim Farley at UCLA, when he said, "This is where we're at. The only way to open up our economy is to do it gradually and to see what happens, and to dial things back if the disease spreads so that our hospitals aren't overwhelmed. It's an imperfect science. There's no perfect way to both open up our economy, to try to preserve people's livelihoods and stem the economic suffering, while at the same time making sure that COVID-19 doesn't get the better of all of us." And that's exactly what's happening today. We've now tested more than 1 million people in Los Angeles County. Your city and county governments have stepped up to answer the call, to take unpopular steps, to make sure that there's access in all communities to deal with this unprecedented threat that, as I remind us every single day, is no less dangerous today than when it first came here, even as we get smarter in understanding how we can deal with it. But in recent days, the trend is clear. Cases are on the rise. The county recorded 2,002 new infections today, bringing our total to 105,507 diagnosed cases. And 595 of those 2,000 were here in the city of Los Angeles, a little bit under 30%, bringing our city of Los Angeles total count to 45,746. Hospitalizations are climbing. They haven't quite met our peak, but they're very close, just under 1,900 people who are currently hospitalized in our county hospitals because of COVID-19. And it's above our recent averages of about 1,400, which we've enjoyed for a number of weeks. And by enjoyed, I don't mean we enjoy that anybody is hospitalized, but it was evidence of the work that we were doing collectively and that we have to together return to. This spike in infections and in hospitalizations is serious. I know we're exhausted. I know that we let down our guard. I know some of us think that we're invincible, but this disease reminds us that we're not, and that we have to be vigilant, that we cannot let COVID-19 prey on when we get lazy or exhausted, or when we think this is behind us. We took this seriously in March. We took this seriously in April. We took this seriously in May when we sacrificed and we stayed at home. We stayed safer in our homes. We saved thousands and thousands and thousands of lives. That's something worth celebrating. And we need to show that same commitment right now to flatten the curve once again. We here in Los Angeles were the first major city to require face coverings, and we must continue to wear them. We were the first city to offer universal testing, widespread to all of our residents, with or without symptoms, and you need to get a test if you think you need one. We were the first big city to shut down public spaces and to prohibit group gatherings. And I want to remind you, you still cannot gather in groups. Whether you think you can get together to celebrate something like a birthday with folks who are not in your household, even if you know them or related to them, that is still prohibited. Gatherings and getting together with anybody except for those you live with will help spread the virus. And that's why businesses and places where people gather are closing or must operate differently. We're in a dangerous moment, and it requires all of us to take control of our collective future. We are powerful, and you are powerful when you make the right decisions based on the public health advice that we are told every single day by our public health professionals. We need to not let our guard down, Angelenos. We must also make sure that we implement temporary measures to bring these rising numbers back down. Earlier this week, Governor Newsom announced that bars would be closing in a number of counties, including Los Angeles County. and the county closed beaches, piers, and beach bike paths over the July 4th weekend, beginning on Friday, July 3rd, through Monday, July 6th. I spoke with Governor Newsom this morning, and I told him that I support regional action across cities and counties because we are really one metro area here in Southern California. It's so confusing for our public when certain places have things open and other ones have them closed. And from a public health perspective, this works best when we're all playing by the same rules. I also told the governor that I support his I know difficult decision to close indoor dining at restaurants for at least 3 weeks. This is a painful decision, I know, especially for our restaurateurs, but it's a necessary one. And restaurants are absolutely not closing. They have never closed during this entire crisis. They can continue to offer takeout, pickup, delivery, drive-through, and outdoor dining now. And my LA Alfresco program, together with the City Council that we have launched, helps restaurants and permitted street vendors to be able to quickly add outdoor seating with streamlined, no-fee temporary permits to be able to eat in our outdoors where it's safe. So far, on our sidewalks, our private parking lots, and portions of our city streets, we've seen 560 of our restaurants receive these outdoor dining permits. And we encourage all restaurants who have not yet been able to sign up. Let us work with you and see if there's a space or a place adjacent to your restaurant where we can make sure that you too can continue to serve customers at coronavirus.lacity.org/LA Alfresco. And I hope our residents will continue to support our city's wonderful restaurants. You just cannot eat inside for this at least 3-week period. To be clear, everything we do is not going to make things better. I want to be straight with everybody. For anything we do today, we won't see the benefits for 2 to 3 weeks. That's how this disease works. Just as we're learning from 2 or 3 or 4 weeks ago what the impact has been of us letting down our guard or some of these openings happening as well. My goal is to make enough progress so that we can say by the end of the summer, we're looking at opening schools in the months ahead. I know that these changes are really hard, especially for businesses that are facing the worst economic crisis since the Great Depression. Our unemployment rate is 21% in Los Angeles County. I know the pain that Angelenos have felt. It's why we launched our Angeleno card program. It's why we made sure that there were bans on evictions. It's why we're going to continue to roll out things to help everyday Angelenos, even as we advocate at the federal level as well. Too many people are still hurting. And as they sacrifice and stay safer at home, our workers need expanded federal unemployment insurance benefits to continue after July 31st. That date is weighing on the shoulders of the breadwinners in our families like a heavy anchor. The economic crisis that accompanied COVID-19 won't end anytime soon, certainly not in a month's time. Nobody believes that. So it's time for our Congress and our President to step up and to continue that help. These are Americans, and I'd want to remind whether they are immigrants or not, everybody who contributes to America's prosperity and our safety deserves help, and I hope that this time we will not discriminate against anyone, whether it's an immigrant, the spouse of an immigrant, a child of an immigrant, no matter who we are in the economy, we all are precious and need that help from Washington, D.C. And so I'm calling on Congress to ensure that this emergency lifeline remains in place, and that legislation introduced today by Senate Minority Leader Chuck Schumer and Senator Ron Wyden of Oregon would do just that. And while we don't know what tomorrow's jobs report will say, we know that there are millions and millions of Americans who are not working, and for many who are still working, their hours have been greatly reduced. Expanded federal unemployment insurance benefits must be a core part of a coronavirus relief package that Congress negotiates this month, and they must help states and local government as well. The House of Representatives has already passed the HEROES Act. It's time for the Senate to step up and do the same, to preserve jobs, to help our economy, and to ensure critical city services delivered by frontline workers who are helping save lives today are not endangered by Washington's intransigence. I want you to know that together with the state and the county, we are continually assessing where the virus is going, that the pain points in our reopening, and that those pain points are guiding our decisions about what we do moving forward, how we change course or what we reopen. So let me make it clear, absolutely crystal clear, to any business refusing to go by operating guidelines. And I said this 2 nights ago. After 3 weekends, we saw half of restaurants, for instance, not complying with the most basic rules that are not optional. It's not a menu. They are mandatory. You need to comply with all regulations. The governor announced stepped-up strike teams from OSHA that will be going in there to make sure that workers are safe, that businesses are abiding by these conditions, and the county health inspectors that have gone out there every day will look at you and, if necessary, close you down, because you don't just endanger yourself, you endanger your workers and our economy when you're not playing by the rules. These protocols are also there in a positive way for you to read, to assess, and to implement, to preserve the lives of your workers, yourself, and your customers. And they're readily available, they're easy to read, and we've tried to make things as simple as possible to help LA businesses get back up and running. And those are all at coronavirus.lacity.org/business. Check them out today. Spend some time implementing whatever you have not done. And our business ambassadors will seek out businesses that are not in compliance with the 3 E's, with education, with encouragement, and yes, if necessary, passing on for enforcement. We will not hesitate to shut you down, but we don't want to shut you down. We just want to help you get in compliance. To support this business ambassador effort, I'm announcing tonight that we're activating Volunteer LA's Disaster Service Worker Volunteer Program. People who will now be asked to call businesses in the city to inform them about new protocols and to point them to resources, to let them know when there's been complaints, and to help them abide by these rules. If you are not yet a disaster service worker volunteer, and this is open to the general public, we already have thousands of people who have stepped up to help, and you can sign up at volunteer.lacity.org and click on Get Started to sign up. From the start of this crisis, I've made clear that data and evidence will inform every decision that we make, and so will our commitment to transparency. Information and data on the threat helps us all inform our behavior, guides us to better days. We're looking at our infection rate to the positive test rates. So to make things easier and clearer tonight, we're going to begin posting the risk of COVID-19 infection on our website with a new indicator that shows you the COVID threat level. You can find this at coronavirus.lacity.org/threat level. And the infection threat level will be shown in the simplest way possible with colors, using red, orange, yellow, and green. I'll share this threat level with you at briefings moving forward. And today, we are at orange. That means that the risk of infection remains very high, with 1 in 140 people in LA County estimated to be infectious, and as early as next week, as many as 1 in 100 or even 1 in 70 LA County residents being infectious. When the indicator is orange, you want to stay at home as often as possible, as you can, and only leave for essential activities like going to work or going to the market. And you should assume everyone around you is infectious. Red would mean that we are still at the highest risk of infection, and residents must stay at home and take precautions, and will likely be on a mandated safer at-home order, as was the case from March to May. Yellow will indicate we're successfully flattening the curve. Green will indicate that COVID-19 is mostly contained and presents a very low risk to Angelenos. We all want to live in that green and yellow area until there's a cure or treatment for COVID-19. But right now we are orange. And as I mentioned, 6 out of the 7 critical indicators are heading in the wrong direction. While deaths continue to go down, although today we saw deaths creep up from yesterday, the other 6 indicators have shown that our hospital capacity is being taxed, that our positivity rate is going up, that the number of cases has surged. And so we are in orange, and we recommend that you stay at home whenever possible. We're working closely with the County Public Health Department to identify also where COVID outbreaks are happening. Instead of taking a cleaver and shutting down everything, we want to find those places and spaces, those populations and the people who are disproportionately becoming infected, so we can surge resources there and address that without having to shut everything down. This includes 20 skilled nursing facilities where we are sending our mobile testing so that residents and staff can get further testing in places where we've seen some outbreak. Infections overall, though, I'm proud to report, at our skilled nursing facilities have decreased significantly, and we've cut deaths in those areas by more than half. But additionally, we're seeing outbreaks, and we're very concerned about these, at several factories in the central and south LA parts of our city. Many of the workers who work in these factories are low income. Some of them speak English as a second language or are non-English speaking. They may not have a car or available time to go to a COVID drive-through testing center. These workers can unknowingly take their virus home to them in dense residential areas, which poses a threat to all the people who live with them and their neighbors, especially those who are older or who have underlying health risks. So to help the county address these outbreaks in LA, we're going to be sending our COVID mobile testing teams to test directly at these sites. We know that many factory workers come into close contact with each other on the factory floor, that as hard as we try, the 6 feet physical distancing rule is getting broken. And to help reduce the risk of infection, these workers should wear both a face covering and a face shield. Wet Design, which is a local firm that I've mentioned, an innovative manufacturing firm that does the fountains that we love in places like Bellagio and Las Vegas and other places, they stepped up in this crisis and started to manufacture face shields as part of our LA Protects manufacturing initiative. And today they have donated 10,000 of these face shields for our factory workers, as well as 5,000 for some of the most vulnerable Angelenos in nursing homes. And I'm also grateful to our team at Logistics Victory LA. Utilizing a donation from Harbor Freight, Logistics Victory is able to immediately give 9,000 face shields to our factory workers at no charge. We're going to roll these out to make sure our workers are protected, that their families are protected, and that our city is protected as well. So if you're a manufacturer or you work at a nursing home in the city of LA or you operate one of these facilities, please go to laprotects.org to let us know that you need face shields, and we'll get them to you. And anyone can go to laprotects.org to secure supplies as well. These are still very tough times for Angelenos. I wish I could just come and say things are always getting better, but they won't always. We'll have to learn and quickly change. We'll need to sometimes ramp things up and sometimes ramp them down. But I want to thank all my colleagues who are doing everything that we can to lessen the load on LA residents, to make sure our fines and fees are reduced in these times, to make sure that we roll out programs like our rental assistance programs, $100 million for low-income Angelenos and their landlords that will roll out in the next couple weeks. I thank our City Council, I thank our Board of Supervisors, and my fellow mayors and council members in our neighboring cities for doing the right thing to step up and to help mitigate the impact of this unprecedented crisis. I know with August just around the corner, a lot of people ask me and fellow parents, what's going to be happening with schools in the Southland? Will kids be able to return to classrooms in this fall? Will they be safe on campuses? Are we going to find ourselves unable to go back to work? Because for so many adults, if our children are not in school, we can't imagine being at work, and our children are going to need us to help them with their studies at home. That's a decision that's not just up to our school districts, who I know are working hard to prepare for, if the numbers are good, being able to open. It's also up to each one of us. If we are able to dial back the infections, we can see our schools open up in the fall. But if we don't keep protecting ourselves and our families, schools may not be able to open. So we need to make progress now. We need to make a commitment, a recommitment now, to bending this curve and doing the right thing, making the right decisions even when they're painful, even when we're sick of being at home, even when we want to see each other. We know that's when this disease thrives. So it's up to us and our decisions. To young people, I remind you, you're not immune. It is not a time to get together and to party with folks who are not in your household. To the young people that are abiding by the rules, thank you. To seniors and those with immune compromised immune systems, you need to stay at home for sure in these 2 weeks and go out only when you absolutely have to. The 4 things I've said: be respectful and wear a mask and or a face shield. Be responsible. Maintain your physical distance. Be safe. Clean surfaces and wash your hands. And be proactive. Make sure that you're getting a test if you need one. To reiterate, everyone should know about the testing options that they have. You can go to coronavirus.lacity.org/testing. Of course, over the weekends and with the holidays, they won't all be open, but we're working with volunteers and making sure that there are tests throughout the rest of this week and beginning after the holiday next week. And everyone should be responsive. If you get a call from LA County Public Health, from a contact tracing team that appears on your phone as LA Public Health, please answer. And if you're away from your phone, please call them back. And please be honest. We're seeing anecdotal evidence where people are saying, oh, I was only in contact with 1 or 2 people. Maybe a factory worker who's worried that saying everybody else's names is going to get her in trouble. Worried that because it's government, that maybe they're going to share your information with somebody else. All of that is false. Nobody will ask you about your immigration status. We need to know all the names to protect their lives. If you don't share those names, they could be at risk. They could lose their lives or their family members. And so help us make sure we can track and trace where this disease is living here in Los Angeles. And everyone should be wearing your face covering. I'm not asking you, I'm telling you. If there's no mask, there should be no service. In any of the places where we shop, where we work, if you're in contact with another person, wear that mask as a way of saying, I care about you. That you care about that frontline worker who's still going to a grocery store today when 1 out of 140 people that steps in there is infectious. To that nurse, to that tech, to that doctor who is still in a hospital today as those beds begin to fill up again. Wear that mask and say their lives are important to you. And everyone should cancel their in-person plans for July 4th. Gatherings with people who do not live in your household are not allowed. I loved what our governor said. You know how to express your patriotism this year? It's not going to be at a fireworks show. It's not going to be at a barbecue. It's going to be wearing a mask and keeping your distance. That says you love your nation and the people who live in it. So Los Angeles, don't let up. I know you can do it. You are powerful when you exercise that judgment, when you make the right decisions, and you take back this moment from COVID-19 and return it to the people of our city. We know what we need to do, so let's all stay safe, let's all stay healthy, and let's all stay at home. Strength and love and justice, Los Angeles. With that, I'll be happy to answer questions. Thank you.
And first, we turn to the line of Claudia Piscuda with KNX News Radio. Please go ahead. Your line is open.
Good evening, Claudia.
Hi. I have a couple of questions. You mentioned testing appointments, and county officials said earlier today that all the appointments for this week at the county and city sites are filled. So if you could address that. Also, I'm wondering your reaction to LA Unified slashing the school police budget and the resignation of the police chief in the wake of that. My third question is regarding high-rise office workers. I'm hearing concerns about people who are being asked to return to work at high-rises, and that would, I guess, be a especially big concern for you given the concentration of high-rises in downtown LA and the fact that people would have to be in elevators and crowded lobbies and whatnot. So any, potential changes or guidance on that specifically? Thank you.
Sure. On testing, I know that there are moments when things are filled up. Let me get back to you by the end of this Q&A to see if all the city ones are. We always do see in the day also some open up. One of the good things is it used to be as much as a 30% cancellation rate. We're seeing 90% of people show up and wait, but we do have 10% capacity in the afternoon. Sometimes ones will free up. But let me check on whether they're booked through Friday. As I said, Saturday and Sunday and Monday, because of the volunteer workforce, we had some difficulty being able to keep them all open. But we will have the Crenshaw Christian Center open on Monday, doing thousands of tests as well. In terms of the school district, this is a moment to reimagine public safety. And I do respect deeply the calls for, in some school districts in America, there are more police officers than there are counselors. Here in Los Angeles, I think there will always be a need for public safety. We have campuses that have to be protected on weekends and after hours. I do think for our youth, as much as we can, look at a public safety approach where people maybe are not in uniform and not with weapons, where we can, just as we're doing here in the city, look at not putting everything on the shoulders of police officers, that is very healthy. In terms of the police chief, I have a ton of respect for him. Chief Chamberlain is a good man. I don't know any of the particulars of his decision there, but I'll just say good things about him because I've worked with him over the years when he was part of LAPD and have a ton of respect for him. I do think a task force is the right way to do it. These things require not just, moments where you do something to check off a box or moments where we pander. This is moments for policy, maybe less pandering and more pondering. And I think in this case, having a task force is just doing that, giving us time to think, giving us time to reimagine, and doing it in a responsible way. So I'm very supportive of that journey and glad that that passed at the school board. I should also say I'm glad that the City Council today was able to pass the $150 million of reimagining some of our own budget money and to put that into investments in preventing crime, in new ways of looking at public safety, in relieving some of the pressure on our police officers. And while that doesn't come exclusively from our police department, that's shared across our departments, no department is exempt from that. And so thank you to the City Council for that. So then finally, in terms of the high-rises, I hope I'm getting all three questions that you said. Yeah, high-rises. Nobody is obligated to go to work under the current orders when you still can work at home. And I want to reemphasize that for employers and bosses out there as well. And it is the public health advice that if people can still telecommute, they should telecommute. So, in terms of people being forced back in high-rises, I know that there's been tremendous and good work done by our building owners in terms of the elevator protocols, cleaning. I'm confident in what they've done. But I do want to remind employers that employees are not obligated to return to work if they still can telecommute, and that we should, especially in this time period of these next 2 to 3 weeks, make sure that that is the policy. We're adding Monday appointments, I'm told, as well, in about 5 minutes, so those should be opening up. So let people know that over the long weekend there will be ones available on Monday, but I guess right now it is booked through Friday. As I mentioned, you can always check back in the afternoon. Sometimes there's ones that free up. Thanks, Claudia. Next question. Or questions?
And next we turn to the line of Joel Pollack with Breitbart News. Please go ahead.
Hey, Joel, how you doing?
Hi, Mayor. On some of the earlier calls, you warned people that there was still a risk if they went out to the George Floyd protests. And I'm wondering, first of all, if you think that those protests with the tens of thousands of people had some effect on the spike. And then secondly, there have been a lot of reports in a variety of outlets, local media, that morale in the LAPD is at record low and police officers don't want to show up for work or they want to retire early and they're not sure how they can continue. So I was wondering if you could comment on that.
Sure. Let me pick up that one too. I don't think we have to choose between holding police officers accountable and also having a ton of respect for who they are. I know that some people hear that through their ears, get angry with both of those statements, but I'm never going to choose between those two. And I do acknowledge that. I've taken time myself to stop and talk to police officers, to go on some ride-alongs, to tell them that, the future may seem scary, but it shouldn't be. It's something we need to embrace together, that policing always evolves, and that I want to listen to them and their frustrations and apologize for anything that may have been reported or misreported. For instance, I never have said that LAPD officers were killers, but that was something that was put out there. And I said, I just want to say, I'm sorry for the pain you might have received that with, because I did not say that, and I would not say that. I've seen heroic work that our police officers have done. I've also seen behavior that has no place in our department and should, not only in the tactics, but sometimes the culture, be eliminated from our department. You can't run away from either of those things. And I want to lift up who our public safety, our peace officers are, while also asking for all of us to reimagine. There is such a weight on their shoulders right now. We need them to feel good about who they are and what they do, but we need to make sure that that's also not having an impact on people who live here and pay their and my salaries in a negative way. And I think study after study shows across America there's some things we have to fix with that approach, and that should be done together. So I invite them to be at the table. I saw good signs, for instance. I know everybody always pits unions and leaders and activists against each other. We saw our police union take out ads with 2 other police unions in the state embracing important reforms that 2 or 3 years ago would have maybe been unthinkable to hear from a union. There's always a place at the table for anybody who is serious about this work. And to our officers out there, I want them to remember why they became police officers. I go to nearly every single graduation, and I talk to every single recruit as I go down the inspection line. I hear where they're from and how they often grew up here in Los Angeles, or an immigrant who moved here with the dream of becoming a Los Angeles police officer. I know that they have put themselves, their bodies on the line, where they sometimes know that they might not come home to their families, and we need to recognize that. But that's not mutually exclusive from an agenda of making sure policing is reimagined in our country, too. We've done that at other important moments, and we should not shrink away from that, whether it's in our school district or whether it's in our Los Angeles Police Department. So I want to lift that up. In terms of the protests, I talked again with Dr. Ferrer about that this morning. She does think some of the spread did come from our protests. It's not the act of protesting. That's a great and American thing to do no matter what your opinion is, and I will always fight to protect that. But protesting without maintaining physical distancing, without wearing your mask, without having sanitizer, we just have to be smart. We have to use that whether you're at a protest or at your home, whether you're in your workplace, or whether you're out shopping. These rules don't change, that we should be responsible. We should wear a mask or a face covering, or face shield, excuse me, that we should wash our hands and sanitize surfaces, that we should maintain our distance. And yes, I'm glad to see many people being responsible and proactive with getting tests. And I'm glad that we were able to ramp that up to meet that demand. I know it's tough with a holiday weekend, but we were able to meet that demand this week. We'll continue doing that, and we won't rest until we know where this disease is and let people know how they can protect themselves. Thanks for the questions, Joel. Next question, please.
Next, we turn to the line of Nick Goldberg with the Los Angeles Times.
Hey,
Please
Nick.
go ahead.
How are you?
Hi. How are you doing today?
Good. Good to hear you.
Good. I'm wondering, are individuals who violate the mask rules being ticketed by the LAPD, or are those rules being enforced in any other way? And if not, why not?
They're not being ticketed. We've gone over this a few times, but let me restate just from a public health advice perspective. This is really on all of us. Even if you gave tickets out, that would not be something that public health professionals recommend is the best way to get compliance. The best way to have compliance is to educate people and to encourage people and then to provide. So, we have had in parks, for instance, we hand out masks. We've had city employees who've gone out with vulnerable populations and made sure folks, for instance, experiencing homelessness who probably couldn't get facial coverings had them. Factory workers who can't afford it, the face shields from today. That is much more bang for buck. I don't want to turn Los Angeles into a police state. I don't want to have people who are worried that suddenly they're going to have a ticket that's going to cost them in a moment of economic downturn, a lot of money. It is important for us to lead on this. Where we do see people blatantly violating or trying to infect somebody or saying that they, not wearing a mask and I have COVID-19, yes, we have had law enforcement engagement with them. But this is on each one of us. I don't think there's, places that have effectively shown fines outside of more authoritarian states are the right way to get compliance. And here in Los Angeles, our numbers have been strong. There's easy ways to always find somebody. There's somebody in a park. There's somebody on a beach. There's somebody who's not wearing masks. But, as we looked in Metro, for instance, we handed out to our customers masks. We have 95% compliance in the latest study that we showed out of LA Metro on our buses and trains. Those seem to be the more responsible way to help people, to educate them, to encourage them. If we see widespread non-use of masks, yes, there could be some enforcement, but again, it should be enforcement that's, hey, can I get you a mask? You're not compliant, not slapping somebody with a ticket. We also want to make sure that that goes straight through for our own employees too. And we don't hold ourselves to we don't hold ourselves immune to that. Whether I know there's folks who said, I saw a police officer who wasn't wearing a mask, I saw a city rec and parks worker who wasn't. It's my expectation that all of us, including city employees, will abide by those laws. Thanks, Nick. Do you want to follow up on that or anything else? Okay. We'll go to the next question then. Thanks.
Can I conclude from that you're satisfied with the level of compliance?
No, I'm never going to be satisfied with the level of compliance short of 100%, but I just also know giving tickets won't get us to 100% either. We have to be sensitive, different cultures, different languages. We have to be relentless, I think, in our communications. We have to be relentless in our education. We have to be relentless in our encouragement. We have to be relentless in where we help folks who might not be able to get masks and put that out there. So that's really where I put most of my time and energy in ramping that up rather than some sort of enforcement regime.
Thanks.
Thanks, Nick. Next question, please.
And next, we turn to the line of Emily Dugdale with KPCC. Please go ahead.
Hey, Emily, how are you?
Hey, how are you?
Good.
So my question was kind of asked a little bit there, but I'll just follow up a little bit more
Sure.
on it. Obviously, people are posting a lot of photos on social media of LAPD officers not wearing masks, and I want to hear a little more about how the city's planning to enforce these city requirements to wear masks with LAPD officers.
Sure. So early on we had that. We've had, the chief go to roll calls. He's made it clear, and it's my expectation, just like the rest of the city, while we don't have 100% compliance, it is my expectation that our general managers, our chiefs, our executive directors will enforce in their respective 38 departments the protocols that are part of our county health orders and our state orders, full stop. So again, I know in this day and age and in such a big city we can find those examples. My goal is to minimize those down to zero. I don't pretend that tomorrow we won't be able to see another one. I know when there's posting, people figure that's every LA City employee or every LAPD officer. That's not the case at all. And we continue to monitor that. We continue to enforce that. And it's my expectation of each general manager and or chief and or executive director, in other words, the people who lead my departments, that they are responsible for that, and I will hold them accountable to that. Thanks, Ellie. Next question.
Next, we turn to the line of John Rigardi with Los Angeles Magazine. Please go ahead.
Hey, John.
Hey, Mayor. You've long discussed the need to prevent hospitals from being overwhelmed. Given the rising numbers and that ICU use and deaths are lagging indicators, how concerned are you about our local hospitals being able to bear the load? And as part of that, do you anticipate the convention center being pressed into service as a medical facility? And would you consider asking the USNS Mercy to be directed back to Los Angeles?
I haven't thought about the USNS Mercy yet. It could be helpful. I think that would be one of the last ones we'd call. We actually enjoyed the medical teams more than I think the ship wound up being utilized, though we very much appreciated the Navy bringing it here. In terms of our capacity, I feel confident in the medium term, but in the long term, I'm worried. So short term, we're still at a decent place. Medium term, I know we can surge up much more. We had surged, anticipating things might get worse in March, April, May. And then hospitals unsurge because that's a lot of resources in each hospital to change beds, re-engineer spaces, et cetera. But we do have the capacity. I'll give you a great anecdote that, the state was about ready to wind down the convention center site. Our numbers had been good enough. We were looking at that as well and talking to the county about their needs. As we saw these numbers tick up, we put a hold on that so that the convention center can be available, so that it will be available. I spoke to the governor about that today. We spoke to Mark Garladucci, who's the head of emergency services for the state, and we're going to keep that on some sort of life support should we need to ramp that up. Similarly, St. Vincent's kind of got closed down, but it's still there, and I believe the county can reactivate that too. So I feel very confident in the medium term that we'll have enough beds and spaces if we need so. It starts first with hospitals expanding the number of beds they have, then our secondary sites like the Convention Center, St. Vincent's, and some other places. And then third, the long term, though, if we don't see our behavior, these additional closures have an effect, and if we get into red on the threat indicator, then yes, we will be in a place where we really could be in a place coming close to where New York was, where we're meeting capacity in certain hospitals and becoming overwhelmed. I do believe we have plenty of time to prepare for that. These are worrying indicators, but these aren't ones that should cause any widespread panic at all. We still have many, many ventilators, hundreds, I don't have the exact number, but close to 1,000 ventilators, if not above. We have hundreds of beds that we can surge and or are available. But we could be at capacity with them in 3-4 weeks. So we are preparing to make sure we can go to additional sites. And it could be that sometime in August, if we don't see these numbers and the rate of increase come down, that we could be overwhelmed. So look at what we see in places like Inland Empire and Riverside and other places where they're at 99% capacity. a lot of people hear those numbers and think, wow, that sounds horrible. Usually, ICU beds are close to capacity because you want to operate, if you're a hospital, as close to what the need is. You don't want to keep 50, 60, 70% empty all the time. That's very expensive and a waste of space. So you always operate in this margin of that 10 to 20%, and we're seeing that number close down in some other neighboring counties, and here it'll be important for us to safeguard that. So in conclusion, medium term, feel strong. Long term, I'd be worried if we don't beat that down. We have 1,204 ventilators, I was just told, that are available today. So those are good numbers, higher than what we had in the past, but if this trend continues, they will be taxed. Thanks, John. Next question, please.
And next we turn to the line of Gina Pollock with KPCC Radio. Please go ahead.
Hi, Gina.
Hi, thanks. So my question is about contact tracing.
Yeah.
You said that everyone who tests positive for COVID-19 in LA County will get a call from someone from the Department of Public Health asking them who they've seen, who they've been with. And so I'm wondering if, as a result of those calls, we know where the recent spike in infections originated, or at least some of those clusters. I'm curious if it was bars or parties or indoor restaurants or beaches, like if we just know any more info about that.
Sure.
And then also, you mentioned that a couple factories were the sources of outbreaks. Can you share the names of those factories with us?
So that's LA County Public Health. I'm going to ask you to ask them to make sure, because I'm not sure if that's confidential or not. I know that one was at least in the apparel industry. We've seen, there's no one easy answer to that. And it's something that I ask all the time, partially because the data isn't that precise, but partially too because it is really widespread. There's not one particular place this is happening. I think all of us have let down our guard, whether it's employers, whether it's young people getting together, whether it's folks having kind of celebrations by not saying that they are. I'll give you a couple more anecdotes. One I shared a couple nights ago that Dr. Ferrer mentioned to me, that there was a wedding celebration that was had, and it was all family members. It was just 30 people. They went out to dinner together. They didn't call it a wedding celebration, but they went on with a wedding and all got together, and half of them are infected. They don't all live together. We think, oh, it's the same family, we're okay. And another thing I wanted to say, too, is a lot of young people's like, well, I got tested last week or even 2 days ago. That test is only as good as that day. The next day, you may be infected. So you can't just say, I've been tested and it's okay for me to hang out with people. It's only a snapshot of that moment whether you are infectious. So we're seeing in companies, we're seeing in our own facilities. We saw, for instance, at our Amundsen Training Center, where our police officers are trained, we saw a small cluster. We've seen them in public spaces. We've seen them in private spaces. So there's not really one. But we did see a number of factories that are in central Los Angeles. We saw some here in the kind of produce mart area. We saw some that were in South Los Angeles. And I'll check with LA County, or you can ask them directly, but I'd be happy in my next briefing to share those names if those are not considered private. But we will be, as I mentioned, when I heard about that, I said, how can we help? And we're going to be surging our LA City on-site testing teams to some of those places. And some of those places reached out to us saying, we don't know how to do testing. Some of our folks don't have cars. Can you come to us? And I thought that was absolutely the responsible thing to do, just as we're doing in our public housing, just as we're doing with people experiencing homelessness, just as we're doing with our skilled nursing facilities who also don't have sometimes the capacity to do the testing. Thanks, Gina. Next question, please.
And next we turn to the line of Mary Beth McDade with KTLA. Please go ahead.
Hi, Mary Beth.
Hi, Mr. Mayor. Two questions. The first is, in light of this deadly spike in COVID cases, what would you say to those planning protests this weekend, and would you recommend that they cancel them and stay home and save lives? That's number one. Number two, how many of these new cases were people who were protesting or had a family member that was out protesting? And are the contact tracers asking this question to COVID-19 positive people? And if not, why are they not asking this question?
Let me check. Those are all LA County employees. We have given 300 of our folks who are now being trained to be contact tracers. So I don't know if the specific question is, but they do ask, where have you been? And they do try to connect the pieces of where people have been. I've asked those same questions a lot because I want to get those answers too. And the most conclusive answer I've gotten is Dr. Ferrer does believe with more kind of certitude than just a couple days ago that that was part of the spread. My advice would be the following. Use your discretion. I think it's very difficult for a government person to say, don't exercise your First Amendment rights. So I'm not going to say one way or the other. But if you do go out, socially distance, maintain that distance. And remember, when people are shouting and chanting, that also can be, I'd take more than 6 feet. I would maintain your mask. I would bring hand sanitizer. I would do all of those things. And yes, wherever we can, use discretion. I certainly want to see this march towards racial justice continue. I don't want to see us let up. I don't want to see that disappear. I don't want it to be just a moment in time, because I think the work that we have to do, and not just in public safety, but with banking, with education, with all the racism and discrimination that we have seen in this country for centuries, we have hard work to do, and I think the people's voice is critically important. But you should not be endangering yourself. You should be using your discretion and always be responsible if you are out there. So we do believe there is a connection. We don't believe that everybody has been doing this safely. And wherever you can, please stay at home. Next question, please.
And our next question comes from Spanish in the line of Gabriel Huerta with Telemundo. Please go ahead.
Hi, Gabriel.
Gracias, señor alcalde. La pregunta es, ¿qué medidas adicionales a las ordenadas ya por el Estado y el Condado tomará la ciudad de Los Ángeles para reforzar su lucha contra la pandemia? ¿Y de qué manera se estará supervisando para que estas medidas se cumplan? Gracias.
So I'll answer both in English and Spanish, and then I'll give my address also in Spanish. We're taking a number of steps. Some of the measures we take are not necessarily stricter. As I know it always gets confusing, but I'll say it every single time I make a presentation. The state sets the boundaries and sometimes some of the rules, and then counties determine what you can and can't do. Cities are not able to go faster in terms of opening more things up, but we can be sometimes more restrictive. It's my philosophy that even if we are more restrictive in a city, if you're part of a 10 million county, it has no effect when people can go just next door, can go across the street to work out, to eat, etc. So we have to move together. That's why I've been very supportive of the measures put forward to close down our bars, to stop indoor dining, and to make sure that we have closures of things as well along the lines of what we've seen from the governor. I believe that in the next 2 or 3 weeks, we may need to look at more, and I won't be shy about us going further, but I do want to do that hand in hand with other cities. I'm constantly in contact with my fellow mayors in LA County. I'll be talking to all 88 mayors later this week, I think tomorrow. I want to do that in conjunction with neighboring counties because we really are part of one public health zone. And as we've shown in Los Angeles, we won't be afraid to lead, whether it's mandating these for the first time, closing down our public spaces is the first big city in America to do that, whether it's the safer at home order or more. But right now we are compliant with the state and the county measures. So they are exactly the same. There's not anything additional in Los Angeles City, and there's nothing weaker as well. So las regulaciones por estas órdenes están en las manos del Estado y el Condado de Los Ángeles. Pero como un alcalde de una de las 88 ciudades en el Condado de Los Ángeles, nosotros podemos tomar pasos adicionales. Ahora tenemos las órdenes que son exactos de los órdenes estatales y del Condado de Los Ángeles. Con el cerrado de los bares, los restaurantes interiores, las salas interiores, y también por las medidas, por ejemplo, en las playas en este fin de semana durante la fiesta del Día de Independencia. Pero es importante recordar que nosotros estamos en parte de un condado de 88 ciudades y un área de 5 condados. Es muy importante tomar acciones juntos. Este fue mi mensaje al gobernador Newsom hoy, y gracias a él y el Estado, ahora estas órdenes son regionales. Y es importante tener una región que pueden tomar estos pasos juntos. Y en el futuro espero que nosotros, y si es necesario, pueden tomar pasos adicionales. Pero el poder a cambiar está en las manos de la gente de Los Ángeles y el sur de California. Y este es mi mensaje esta noche. Brevemente, yo quiero dar unas palabras en español también. Before I do that, I just want to thank everybody who's tuned in, who follows this in English, and thank you for doing what you can today, tomorrow, over this important holiday weekend. As I said, things are not going to get better for the next 2 to 3 weeks, but what we do today can impact 2 to 3 weeks from now, whether we can say we have held the line or not. Have a good evening to everybody tuning out, and with that, en español, brevemente también. Buenas tardes, Los Ángeles, y gracias por venir, por este mensaje muy crítico. Es nuestra responsabilidad ahora hacer lo que se necesita para tomar control de nuevo del COVID-19 con acción unida. Logramos empezar la reapertura de nuestra economía poco a poco, debido al trabajo que hicimos en abril y mayo. Y ahora con la subida de infecciones tenemos que dar un paso atrás. Está subiendo el número de casos. Hoy el condado nos informó de 2,002 nuevos casos. En total tenemos 105,507 casos positivos en el condado de Los Ángeles. Entre ellos, 595 están en la ciudad de Los Ángeles, más o menos 30%, llegando a un total de 45,746 casos positivos en la ciudad de Los Ángeles. Las hospitalizaciones están subiendo también. Hemos llegado a 1,900, lo cual es más del promedio de 1,400 en estos meses pasados. En marzo y en abril nos quedamos en casa y salvamos a miles de vidas. Y necesitamos mostrar este mismo compromiso para aplanar la curva ahora. Éramos la primera gran ciudad para requerir el uso de coberturas faciales y todos debemos continuar a llevarlas. Y no podemos juntarnos en grupos. Juntarse con personas que no viven contigo es una manera de propagar el brote. Y por eso los negocios y lugares donde la gente se reúne están cerrando o deber operar de manera diferente. Y los trabajadores en estas industrias tienen derechos. Es su derecho a demandar su cobertura facial. Y tenemos ayuda para todos los trabajadores en Los Ángeles en un minuto. Esta semana el gobernador cerró los bares y el condado cerró las playas, los muelles y senderos para ciclismo en las playas durante el fin de semana de julio, empezando el 3 de julio hasta el lunes 6 de julio. Hoy también, con mi apoyo, el gobernador anunció que es prohibido comer dentro de restaurantes. Sin embargo, los restaurantes no están cerrados y nunca han cerrado durante esta crisis. Todavía pueden ofrecer comida para llevar o comedores al aire libre. Y mi programa de LA al fresco, ayudará a restaurantes y vendedores ambulantes con permisos temporales sin costo para comedores en las aceras y en estacionamientos privados y porciones de calles. Hasta ahora, más de 560 restaurantes han recibido permisos temporales sin costo para comedores al aire libre. Para registrarse, por favor, visita la página diagonal al fresco. Y espero que nuestros residentes continúen apoyando a nuestros restaurantes. La crisis económica que ya ha llegado con el COVID-19 no se acabará pronto. Y le estoy pidiendo al Congreso que asegure que el apoyo de emergencia continúa y la legislación de los senadores Schumer y Wyden hará eso. Quisiera que sepan que junto con el Estado y el condado estamos siempre monitoreando la propagación del virus y esto guía nuestras decisiones para avanzar. Y para ser muy claro con negocios, tiene que cumplir con todos los reglamentos para reabrir, por sus clientes y también por sus trabajadores. Y todos los protocolos están en la página coronavirus.lacity.org/business para proteger a sus empleados y sus clientes. Nuestro programa de embajadores para negocios estará visitando negocios que no cumplen. Y si están poniendo en riesgo vidas y empleos, no dudaremos en cerrarlos. Además, he activado a nuestro cuerpo de voluntarios para apoyar a este esfuerzo, para llamar a empresas y ayudarles a conocer los protocolos. Para ser voluntario, visita la página volunteer.lacity.org y para inscribirse. Para continuar mi compromiso a la transparencia de datos para ver que está guiando nuestras decisiones, empezando hoy, estaremos publicando el riesgo de infección en nuestra página web, coronavirus.lacity.org/risk. Y esto se hará de manera muy simple, con colores. Hoy estamos en naranja. El riesgo de infección está muy alta con entre 140 personas infectadas en el condado. Y esperamos que en las semanas que vienen esto estará subiendo. Cuando el color está de rojo, deben quedarse en casa y solo salir para actividades esenciales. Anaranjado, estamos en anaranjado, discúlpame, indica que deben tomar precauciones. El amarillo indica que estamos aplanando la curva. Y verde indica que presenta un riesgo muy bajo para angelinos. Otra vez, hoy estamos en anaranjado. Y este es muy peligroso. No es rojo, pero este momento demanda nuestras acciones para proteger nuestras familias, nuestras comunidades y nuestra ciudad. Estamos colaborando con el Departamento de Salud Pública del condado para identificar lugares donde la infección se está propagando de manera rápida. Esto incluye 20 instalaciones de enfermería especializada, a donde estamos enviando a nuestros equipos de pruebas móviles para que los residentes y empleados puedan hacerse la prueba. Además, nos preocupan varios sitios de fabricación en el centro y el sur de Los Ángeles. Varios de estos empleados tienen bajos ingresos y no hablan inglés y quizás no pueden ir en auto a un sitio de pruebas. Para ayudar al condado a enfrentar brotes en fábricas en Los Ángeles, estaremos enviando nuestros equipos de pruebas móviles a estos sitios también, gratis. Y pueden ayudar a estos empleados a proteger sus vidas. Sabemos que muchos de estos trabajadores tienen que estar en contacto cercano con sus colegas y no pueden mantener la sana distancia. Ellos deben de llevar una cobertura facial junto con un protector facial. Wet Design, una compañía aquí en Los Ángeles, ha donado 10,000 unidades de protectores faciales para trabajadores en fábricas y 5,000 para personas en residencias para personas de tercera edad. Visita laprotects.org si eres un empleador o si necesitas protectores faciales. Todos deben hacerse la prueba. Por favor, visita la página coronavirus.lacity.org/testing para más información de las pruebas también y para una cita por su prueba. Todos debemos hacer nuestra parte en esta lucha, todos. Eso significa cooperando con el programa del condado para localización de contactos, lo cual nos ayudará a identificar personas quienes han estado en contacto con personas infectadas y limitar la propagación en la comunidad. Si alguien de este equipo te llama, aparecerá LA Public Health en su teléfono. Por favor, responde a esta llamada. Es crítica. No son agentes de policía, ni les preguntarás de su estatus migratorio. Solo le preguntarán sobre sus últimos contactos. Y es muy importante dar a ellos sus contactos, a preservar sus vidas, a proteger sus trabajos. Entonces, amigos, por favor, hagan su parte para mantenerse saludable. Quédense protegidos y, por favor, cuando puedan, quédense en casa. Fuerza y amor, Los Ángeles.